Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN West Palm. Now, here's your host, David DePino.
Welcome to the Sidelined Podcast. We're here with Dr. Arun Hariharan. He's a pediatric orthopedic and spine surgeon with the Paley Orthopedic and Spine Institute. That's at St. Mary's Medical Center with the sister hospital right there, Palm Beach Children's Hospital in West Palm Beach. Dr. Hariharan is a double fellowship-trained pediatric orthopedic surgeon with a particular expertise in pediatric spine surgery. In addition to the broad scope of pediatric orthopedic care he offers, his main passions are in caring for children with various spine-related conditions and in treating fractures in children. Dr. Hariharan, thanks for joining us. Former LSU Tiger and current Dallas Cowboys linebacker Damone Clark had a herniated disc discovered during his NFL combine. I remember this back in March. He needed spinal fusion surgery right away, and it was like, is he going to be able to play this season? This is a herniated disc issue that needs surgery. He returned to the field 2 weeks ago. What actually is a herniated disc, and what are the signs and symptoms?
Yeah, that's very interesting, and I'm happy to see what a recovery he's made. So there's all sorts of reasons for herniated discs. So discs are these little cushions between the bones of your spine, and they go all the way from your neck really to the top of your butt. And they help us move our spine from side to side, front and back, and kind of act as shock absorbers. But behaving that way, and just like shock absorbers or suspensions in vehicles, things can go wrong. And in young patients like that, usually from accidents or an injury or a bad tackle, those discs can, for lack of a better word, squeeze out and pinch one of the nerve roots or even part of the spinal cord, which can cause pain. And that pain usually is some sort of numbness or tingling radiating down from the neck into the arms or from the lower back into the feet and toes. In older patients, that usually happens because of arthritis, but in athletes and younger patients, it can either be something they're born with or because of some sort of injury.
Yeah, and Clark went on to deliver 40 defensive snaps in a game 2 weeks ago. I should say play. He didn't deliver. In his NFL debut, along with 17 on special teams, he logged 6 tackles in the process. I was watching the game as they were talking about it. He had this run where he chased down Justin Fields, and they have this new next-gen stats era that everyone's talking about.
Yeah.
He ran 22 miles per hour. They said this is after having herniated disc surgery in March, and I was just baffled, fascinated. Are you surprised at how quickly? I mean, obviously this is a world-class athlete, but someone nowadays can bounce back from that type of ailment?
A little bit surprised, but also not. These guys are in the best shape of their lives, and they're elite athletes with amazing biology on their sides. And also, medicine and technology is better than it's ever been, and especially with spinal fusion surgeries or disc surgeries. He has done some amazing things, and I think he'll have a great career. But even more popular names that we might know of, like Tiger Woods, had a spinal fusion surgery on his lumbar spine, went on to win multiple other PGA Tour events afterwards. And then Peyton Manning, he had 2 neck fusions and actually won a Super Bowl afterward on it. So,
that's right. It elongated his career. I remember watching the play when Clark got hurt, and I think it happened in college, and then they kind of noticed it during the combine. How does spinal fusion surgery work to alleviate the herniated disc ailment? And then, obviously, this was like a severe ailment. Is there a non-surgical approach maybe for something that's not as severe, but then in the case when you look at it as a medical doctor and you decide like the only option is surgery, so there's 2 different avenues or no?
Yeah, absolutely. Disc herniations, like almost any other orthopedic condition, comes in so many flavors. And first and foremost, we want to try to avoid surgery as much as possible, especially a fusion surgery. And in many patients, and in many cases, when it's not severe or causing any neurological deficits, and simply time, physical therapy, and a course of anti-inflammatories can make a huge difference just in a matter of 6 weeks to 3 months on returning to some sort of baseline, and it just gets better and better and better over the next year or so. But if it keeps happening, or if there are severe symptoms or intractable pain, then really going in surgically to remove the disc and put in a fusion is the better option. But we try to go from the least invasive to the most invasive.
And great info on herniated disc care with Dr. Hariharan. He's a pediatric orthopedic and spine surgeon at the Paley Institute at St. Mary's Medical Center in West Palm Beach, along with their sister hospital, Palm Beach Children's Hospital, right next door. Besides spinal fusion surgery, what other types of care do you specialize in?
Yes, so I'm a general pediatric orthopedic surgeon, so we take care of children from ages of 0 to 25, and even older in certain conditions for all sorts of orthopedic, which is bone or muscle or tendon-related injuries or deformities, for lack of better words. So that can be hip dysplasia, scoliosis, fractures, or just simple knee pain or flat feet.
That's great. That's a great resource we have right in the community here in West Palm Beach. You completed a pediatric orthopedic surgery fellowship at the Nemours AI DuPont Hospital for Children. You furthered your spine surgery skill set, traveling all the way down to Auckland, New Zealand, to train at Starship Children's Hospital. What was that experience like studying in Auckland, New Zealand? I don't think I've ever met anyone who's been that far on the other side of the world. Somewhere I've always wanted to go is to Australia and New Zealand, so I'm just really interested in hearing about this.
So that fellowship came about sort of serendipitously. I had great training from being in Baltimore and then at DuPont in Delaware, do lots of good pediatric care. But I think it's very important to expand training and skill sets, especially when dealing with the pediatric population. So there's a wonderful hospital system in New Zealand where all the Pacific and New Zealand and even some of Australian children come to get their scoliosis care. It's the only hospital for all of New Zealand, only tertiary care children's hospital. It was a wonderful six months of training and lots of learning happened, but the country itself is beautiful like nothing else. Everybody knows about it from Lord of the Rings, and that's where most of it was filmed. I actually went to the farm where the Hobbiton was built and toured it, but the people are great. It's a diverse area, the scenery, the hiking, the food, the wine, you name it. It's a wonderful place. If you have a chance, you should definitely go.
Yeah, it's definitely on my list, and my wife's as well. She says I have to take her to Australia during this lifetime, so I'm going to try to get both of them done in one trip because it is about 24 hours flight from here, right?
Yeah, about travel time's about 24 hours at least, and then with the time change, which you better have at least a couple of weeks to go.
That's really neat. I'm from right here in Palm Beach County, Jupiter, born and raised, and I actually went to Hawaii, and I was amazed how long it took to get there and to come back. So that's only halfway there.
That's only halfway there. That's right. Yeah, made some great lifelong friends there, and it's nice to have a worldwide connection with these things.
Yeah, it really is. Actually, a very small side story. My daughter was born at Good Samaritan Medical Center, and we went through the breathing classes with another couple. They were from New Zealand. I'm friends with them on Facebook.
Oh, okay.
And he's a chef, and he was here in West Palm Beach working in Palm Beach.
Yeah.
And we're still friends on Facebook. So he said, if you ever come down, look me up. He's a surfer down there and a chef. So I'm definitely going to.
He's in New Zealand now?
He's in New Zealand.
Okay.
Yeah, I don't think he's in Auckland. I'll have to look it up again. But Auckland's the main city?
Auckland's the main city and capital. So the population of New Zealand is about 5 million, and 50% of those live in Auckland.
Wow.
So, but there's still so much more country, and you can drive for hours and hours and hours and see nothing. But there's a certain beauty to it.
I've heard of Christchurch too, New Zealand
as
well.
Yeah, that's
really
where the big
neat
earthquake was a few years ago.
Oh yeah, that's right.
Queenstown is where all the skiing is, and great place.
Wow, that's really neat. I don't think I've ever met, a doctor who did their fellowship training in New Zealand, and I've interviewed a few. So that's great. What's the most common fracture you see? I know that's a special interest you have. Like you said, you do spine surgery, but you're also treating the whole body as an orthopedic surgeon. What's the most common fracture care you provide?
I think the most common in children is elbow or wrist fractures. And one big thing to understand, in adults, this almost always means surgery. But in kids, they have so much growth remaining and such, they're almost like little salamanders. You can leave a bone crooked like 25 degrees and it'll straighten out depending on their age. But obviously, we won't leave it 25 degrees crooked, but we can look at it in their pictures, straighten it out right in clinic, put a cast on it, and by 4 to 6 weeks, people are good to go. And this is very different from adults, and it's really a beautiful thing to see.
Kyphosis, do you provide treatment for this condition? Can you kind of explain it a little bit?
Yeah. So one of my passions in medicine is spinal conditions, and scoliosis is one most people know about, which is a side-to-side curvature. But kyphosis is a frontward or hunchback type curvature, and there's all sorts of different types of kyphosis. But in our day and age, most commonly we see postural kyphosis, which means people are either wearing heavy backpacks or on their phone or tablets all the time, which causes poor posture. And this doesn't necessarily create your bones to change or cause a deformity in your bones, but sometimes it can. And therapy and proper x-rays are super important to make sure this isn't a long-term problem.
Yeah, we see that with kids sometimes. We got to watch them. They have a lot of books, and there is sometimes too much. And I do the same thing as an adult. I carry my heavy laptop bag always on my right side. Should I switch it up?
I think it's important to switch it up. We don't think it causes any actual scoliosis or kyphosis, but it'll have a big impact on your muscles and the way your body carries itself.
Another condition you treat for the spine, I believe, and I'm probably going to get this wrong, is spondylolisthesis.
Close. Spondylolisthesis.
Yeah. What is that and how is it treated?
So spondylolysis or spondylolisthesis is basically a stress fracture in the lower spine, and this can be one of the dangerous reasons for back pain in children. Usually back pain is just because of growth or not stretching enough, especially the hamstrings or the core muscles, but the stress fractures or spondylolysis is when the lower back joints between two spine bones cracks or fractures. And if this gets severe enough, then the bones can slip on one another, which is the spondylolisthesis. And again, most of these you can treat with just therapy and bracing and time, but sometimes they need surgery.
And so much new technology at the Paley Orthopedic and Spine Institute. Amazing group of doctors. Seems like your team is always on the forefront of medical care and medical technology. Can you talk about another one of your interests, growth-friendly techniques such as vertebral body tethering and MAGEC rods, MAGEC rods?
Yeah, MAGEC is, I guess, the company name. It's a magnetically controlled growing rod. I think, we, as a group, especially in the, limb conditions and spine conditions, definitely try to stay in the forefront with research and education and, work in a team of doctors who have decades of experience doing this. And growth-friendly is easiest explained by saying that even though you have scoliosis that needs surgical intervention, we can still allow your spine to grow. Usually a child's spine stops growing rapidly at about 10 in girls and 12 in boys, but correcting scoliosis in the past was doing a fusion. And that's okay sometimes, and that's the best surgery sometimes because we've done it for 40 plus years, but we have these new technologies called vertebral body tethering where we actually go in through the front of the spine, put in a couple of screws and a really tight rope that straightens out the spine, but still allows the patient to grow a little and still have motion, most importantly. That's why we call it growth or motion friendly. And then the magnetic control growing rods is for the super young children where we put in these rods and screws into the spine but leave most of it untouched. And every 3 months they come to the clinic and we literally put a big magnet on their backs and the rods grow and allow the child to grow with it. So it's been amazing technology that it's only been around for a decade or so, but it has, if used properly and in the right setting, some amazing results.
Well, thanks for sharing all this info. It's just fascinating the way medical technology is moving, and great doctors like yourself are taking advantage of it to help their patients and pediatric patients in this case. So I just want to thank you again for joining the Sideline Podcast.
Yeah, thanks, David. It's, I'm new to the community here, but it's been a wonderful place to work alongside everybody here at Paley Institute and at St. Mary's, so happy to be here.
Once again, Dr. Arun Hariharan is a pediatric orthopedic and spine surgeon with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center, sister hospital right there on the same campus, Palm Beach Children's Hospital in West Palm Beach. For more info on Dr. Hariharan, visit paleyinstitute.org, and then you're going to put in /blog physicians and then his name, Arun Hariharan. That's ARUN-HARIHARAN. Dr. Hariharan's email is there, or you can request an appointment with his office at 561-844-5255. And we'll talk to you next time on the Sideline Podcast.